Welcome to the Recovery Playbook, brought to you by the Menninger Clinic, a national leader in mental health and addictions treatment. I'm your host, Dr. Daryl Shorter.
And I'm Ryan Leaf, and we're here to answer and talk about all your questions and thoughts when it comes to addictions treatment.
And what are we talking about today?
Questions that are going on in the rooms, that are going around everybody's heads about what's going on in addictions treatment.
Yeah, okay. I'm going to go ahead and get started.
Yeah, these are from fans, by the way. We have fans all over the country.
All over.
They really like Dr. Shorter. They're still quite skeptical of me, but
I know about that.
Yeah.
All right. So question number one, is addiction a disease or a choice?
Oh, this is absurd. But the fact that we have to answer this question is the absurdity of it. You're a doctor. This has been in medical journals since the 60s, correct?
Probably before that.
Probably before that. And the more and more I have to sit and tell people that this is a disease and not a choice is immeasurable. Okay, so I travel around the country and I do a lot of speaking, anywhere from 30 to 35. And I'm really doubling down on the stigma aspect of things, trying to eliminate that, because I do think it's the last hurdle that we're going to have to get over. It's the thing that's holding everybody back. And I use this analogy, and I think it's very apropos. There's two families on the same block that a child is diagnosed with a brain disease. Mm-hmm. One of them is a cancer. Yeah. The other one is a substance use disorder or mental health diagnosis. How differently those families are treated. Right? So one family, there may be a GoFundMe page started. People bring food. It's about community. The other one, that family may be ostracized, isolated, gossiped about, all of those things. But if you were told that they are both brain diseases, that if treated appropriately, you can go into remission and have this life of your dreams, how differently they would be looked upon. Absolutely. And that is very palpable to the people in the audience when I tell them it, because you're talking about a child in a neighborhood that live and are treated so differently from it. And that's the biggest thing for me. I look at people in the eye and go, do you think I wanted to tear my world down? Go to a prison cell and all the things like that. And then once you learn and understand that it's a brain disease, and then if treated appropriately, like I can have the life of my dreams, in which I have done, it makes complete sense. Yeah. And understanding.
It is one, well said. I love that analogy. It is shocking to me how frequently I also have to have this conversation with people.
Why does he just not stop using? Why doesn't he just stop?
It's, I mean, it really just can sometimes obviously make me kind of stop in my tracks even now, just thinking about like how many times we've had this conversation. And I think where I try to develop some compassion for people that maybe have been on the other side of it is that it can feel really personal to you if you are in the life of someone who has a substance use disorder. It can feel like they are drinking at you or using at you, and that they are trying to be purposefully hurtful. And so I don't want to minimize the very real impact on the lives and the emotional experience and psychological experience of the family and friends and loved ones of someone who has a substance use disorder. I mean, obviously that is clearly valid as well. And is it possible for us to also hold in our minds that this is a medical condition, and that their medical condition results in behaviors that feel very personal, but that they're not choosing to engage in those behaviors? It's the medical condition, the illness, that is driving it.
Yeah, the fear that I always run into with people is that it removes accountability. I think family, because of some of those actions and behaviors, you're like, he has to be accountable for what he's done, though. Yeah. And I get that better than anybody. I can differentiate between a disease and the things that I did that I have to make amends for, that I have to be accountable for. I can't just go, well, I was drunk, or I was high, or it's just my brain disease.
Sure.
There's still consequences to one's actions. And I think that is the differentiation that people have a real problem with. The individual who wants to distance themselves from those actions and those that have been affected by those actions.
And I think that you can, again, hold that in mind as well. Like, people are accountable for their actions. I mean, in the same way that if you have a problematic relationship to sugar and diabetes is a consequence of that, but we don't shame people in the same way
No.
with diabetes that we do with substance use disorders. I think I've mentioned to you my very real love for salty snacks and
Doritos.
Doritos, as you, yeah, the purple bag.
The purple bag.
And, you know, I have high blood pressure. Like, it's probably not in my best interest to smash an entire bag of Doritos. So I have worked very hard on not doing that. But at the end of the day, like, if someone were to come up to me, if my physician were to come to me and say, like, listen, you know, you're a real dum-dum for giving yourself high blood pressure because you used to eat Doritos by the bag, like, that would not be consistent with what we do in any other field of medicine. That would just seem so bizarre. But two, like, how does that ultimately help the individual who has this, like, medical condition now, by shaming them about, like, how they got there and you know, when they're trying to, like, live their lives in a different way?
It's the, like I said, it's the last hurdle. It's the one I want desperately to be able to let people know when, because what it does is it stops people and it limits them from getting the help that they need when they need it. It may be to a point where that we lose them, or it gets catastrophic in terms of family and orientation. And that's the thing that I want to eliminate the most.
And the other piece of it that happens is people then begin to think that the only way that they can be normal or right is if they continue to engage in a behavior that was ultimately harmful for them and for people in their lives. So they can say, like, well, I really would like to go back to drinking so that I can be normal like everybody else. But that's another flip side of the stigma. It, like, can sometimes sometimes push people back into substance use.
It can. It really can, because you go out with somebody and you're used to holding something in your hand in a public setting, you know, or you feel incredibly uncomfortable not being able to be uninhibited talking about things. So I understand that greatly. I'm coming up on 14 years now, and I don't go to bars, though, so I don't, like, you know, the idea of you go to a barber shop enough times you're going to get a haircut mentality, and I don't spend a lot of time at bars. You know, events I speak at where there's open bars and things like that, it doesn't even register with me with that anymore. And so I get it. But I tell you, you figure out pretty quickly too how good life can be without it. You just used it as a coping mechanism for so long, it became second nature.
Habit. This actually brings us to another question. And that one is, am I an addict forever?
Am I an addict forever? I say yes. I'll forever be a drug addict. That is, I believe, the best way to establish that it is a disease, that you are in remission. And you have to continuously treat it throughout the rest of your life, or it will come back. And so, you know, people in semantics, in terms of, like, they say, I'm a recovering addict. I'm an addict in recovery. I don't care how you say it. I believe that I'm a drug addict. It's easier to, there's also ownership in it for me. It takes the power away, I think. A lot of the things I've done over the last 14 years has been to remove the power of what the public looks at it as. When it comes to my failed football career, they like to use the word bust. That's fine. You know, I made a merchandise line that says bust on it and made a bunch of money off of it. So, you know, I started removing power from it. My wife says we built our house out of glass. It's completely transparent, and we're vulnerable, and all my stuff's out there. So no one has anything. I use the finale of 8 Mile when B Rabbit gets up and Cheddar Bob's like, well, what are you gonna rip on him about? You know, because he's got all this stuff on you, man. You know, and he just goes out there and lays it all out in front of everybody, like all his dirt, all his stuff. And then when the guy gets up to battle him, he's got nothing. And that is the truest form of that. And so that's what we've kind of done when it comes to, I am a drug addict. You know, I'm a some I say junkie sometimes just because it's more of a gotcha statement when you're in a maybe public setting or something like that for people to pay attention.
Sure.
I don't know if that's a shaming thing or not. Some people think it is. I don't take it as that. But yeah, I'm a drug addict. I'll be a drug addict the rest of my life.
Yeah. So it's interesting. I think we spend a lot of time in our conversations with patients trying to help them parse through that, as you can imagine. And one of the things that I try to reflect, with people about is, does your substance use move you closer to or further away from your goals? Simply. So if you were to reintroduce this into your life, does it somehow help you get that promotion that you wanted, or does it enhance the quality of your relationships with other people?
Is the answer ever yes? Right?
It never is. And
but
so,
do you get an answer of yes sometimes?
well, so sometimes people will say that they don't want to feel apart from other people. And so there is and they don't want to feel the judgment of other people. And so I think when we talk about our desire as social creatures for a sense of belonging and belongingness, I can appreciate how for some people they may not feel like they belong in however they might define community, as a result of being this sort of outsider, which is one of the reasons why rooms like AA and NA, or if you're in another form of recovery like refuge recovery, Dharma recovery, or smart recovery, whatever your bend is, developing a new kind of community that can ultimately support this behavior becomes critically important, so that there is still a sense of belongingness, even if you're not engaging in a behavior that you think everybody else is doing, when the reality is we're seeing declines in the amount of drinking that people are doing, and that the number of substance users is lower than the number of people that actually are abstinent from substances.
And I feel like this generation, and even maybe at the tail end of ours, there's this wellness kick. There's the idea, and alcohol is absolutely something that limits that and contributes to the lack of wellness for someone. And I think that's where you've seen an uptick in that. I really do believe in it, and it's going to continue around the idea, and it goes back to our first question, whether it's a disease or not, is that those that are truly engaging in the substance use, it's because the disease has taken hold. Yeah. It's not recreational. Like we're just out having a few pops here and there. Sure. The use of the things that are causing so much damage to families and people are rooted in the fact that it's the disease.
Yeah. And to your point about like adolescents and young adults and the trends that we're observing right now, we are seeing declines in alcohol consumption at the same time that we're seeing either flattening or perhaps even a mild increase in cannabis use among certain groups. And so this will be something that we will have to take a look at and monitor over the next several years. The one thing that I think is important for us to keep in mind is that when it comes to cannabis use in particular, people are using higher potency THC products now than they really ever were before.
Of course they are, because they want to be
it's just like, it's not the same.
Altered. The question you asked to your patients, like, is your use of substance abuse, is your use of the substance, is it bringing you closer to the goals that you want? And it's doubtful if you're using, I don't care if it's cannabis or whatever it is you're using, it's doubtful that the answer is going to be yes for that. The more they're using, the higher potency they're using. I am of no consequence to tell people what they should do or what they shouldn't do. My question usually is a why. Why are you doing it?
Yeah.
I'm not here to judge you.
Sure.
If I were to use any sort of mood altering substance, it would be to alter my mood. Mm. There's no reason for me to use it otherwise. It would be to make myself either numb myself, to make me feel more comfortable in a situation or something like that. I just know that now, and that's because of what the last 14 years and the previous 8 leading into it taught me.
Yeah. Cannabis is always that really interesting one because, and I think we've maybe talked about this before, I have a colleague whose mother was struggling with ALS, which is formerly known as Lou Gehrig's disease, and was really struggling with mood, anxiety, and appetite. And so cannabis was one of the things that was used by this person's parent during their final moments. And who am I to say to that person,
Yeah.
like, come on? I mean, if that's what's going on in that individual's life, and I know this is a little bit of an extreme example here, but like, if that's what's going on in someone's life, I'm the last person to say that maybe cannabis is not an appropriate option for that individual.
Well, I think it's a perfect example because you make the extreme example so you understand it's so out of left field.
Yeah.
Like, if someone's trying to have the argument around it and they use this extreme argument, you're like, yeah, this person's dying.
Yeah.
Of course I get it. Hospices exist for a reason.
Sure.
You make people feel comfortable. You don't want people to suffer. So if that's the reasoning they want to give, like, you are suffering then.
Yeah.
You are a 30-year-old person
Right.
who are suffering, so you feel it's necessary to do this, but you're not dying.
And so maybe that's the distinction we're trying to make here then. Like, are we talking about in use in the context of suffering versus use in the context of like recreation and coping?
Yeah.
And so if people are able to make that delineation for themselves, like, all right, I may have condition X, and with condition X, I am suffering, then perhaps this becomes an option for me in that box versus like whether or not I'm using it for recreation or coping. Is there another way that I can like manage those sorts of things? I think that
And if you're having a conversation with your medical professional, then that's a different story too.
Totally.
Like, if this is you self-medicating, if you're not a doctor, and I wasn't a doctor, and I was choosing to self-medicate, right? That's a different story altogether. That's why the open and honest conversation with your medical professional is so important.
And there are plenty of states in our country. And of course, I talk all the time about how we have a patchwork quilt or network of like cannabis regulations and legalization here and not legal in other places. But if you happen to live in a state where medical cannabinoids are legal, like the state of Texas, where if you have certain conditions, which includes ALS, and you can get a prescription for cannabis, then okay, so be it. But you're doing that with under the guidance of a physician and with sort of that in mind. So anyway, okay, good conversation. All right, next question: is relapse a failure or a part of the process?
So, I was just having this conversation with some of the individuals here at the Menninger Clinic yesterday when I was doing my rounds yesterday, and relapse does not have to be a part of the process. So I went to treatment 3 times, so that means I relapsed twice.
Mm-hmm.
It was part of my process. If I were to have shamed it or had others shame it, it could have been absolutely devastating to me moving forward. I think I might have told you this story before, but when I was living in Los Angeles, I lived a few blocks away from Dax Shepard, and Dax has been very public about his sobriety and everything like that. But one thing he did talk about during COVID is that he relapsed, and he had 16 plus years of sobriety. And I remember him doing it, thinking, I don't know if I would have, because listen, you live in the public eye, you're on a platform, and your brand is a bit of the fact that you are
That's right.
in recovery, and I am. I looked at my wife and I said, I don't know if I would have been able to do that if I would have, in the midst of COVID, isolated, no one saw, no one knew, and yet publicly he came out and talked about it. I thought it was amazing. He's like a hero for me because it has allowed me now, over time. I've told you the story about when my father-in-law came to visit, and he had this new pain medication in the house, and I knew immediately it was in the house, and my mind went to use it. My wife intervened. We came up with a great system that he would just put it in an RX safe when he visited. Never thought about it again.
Yeah.
But I use it and talk about it in my speeches and things like now, and as part of my story, that I almost relapsed because I was this close. A lot of people wouldn't admit to that, who have a platform of in recovery and we're doing, things are going so great. Yeah. I don't, like I said, I built my house of glass, and let's talk about it. And so I will shame no one ever for it. I don't believe it has to be a part of recovery.
Yep.
But sometimes it is.
Yeah. And if it is, can we use this as an opportunity to learn from the experience
what led to it,
of the recurrence and like how can you bolster yourself and strengthen your recovery process so that it maybe doesn't have to happen again. And even if it does, then that just becomes another opportunity to, again, redouble your efforts and reevaluate and see what is and isn't working. I mean, people come to me all the time as a result of a recurrence or a relapse. And I'll tell you that 9 times out of 10, when we end up talking about the very first and perhaps second and third times is really like how to reduce the shame that is associated with it. Like you almost can't even get to the why because you're sort of dealing with and sort of digging through the immense amount of shame that people can experience. And so I mean, you're already dealing with a highly stigmatized illness. And then on top of that, you heap shame on top of that because of
What's the hardest part too is when you're part of a fellowship, that there's shaming involved in that.
Yeah.
So whenever somebody who relapses that comes back into the rooms, I just think they're so strong for doing it.
Yeah.
I can't imagine. I remember a guy who had like 27 years came back in and was like, I relapsed this last week. And I was just like, whoa. Like you just can't imagine somebody who'd gone 27 years and all of a sudden it happens.
Yeah.
It's a disease. And this is an even more potent understanding that is a brain disease that is constantly trying to manipulate and infiltrate that tells you that what you're doing is wrong.
Yeah.
And so I have the knowledge of having relapsed twice, and I have the knowledge of almost and finding a positive and healthy way to deal with it. So I have all this knowledge now. I always talk about relapse is ultimately, at least the first pill, the first drink, it's your choice. You have all the information now. What happens after that point is the disease.
Yeah.
And either it takes complete control once again, or to your point, you go back and you attack it with the same vigor and understanding of what it takes to get it done.
Something you said just now made me want to ask my own question, and because it's one of the things that can come up commonly when I'm talking to folks and providing care. How important is it to count days?
I don't think it's very important. The only important day is today. So like I'll look from time to time and see what I'll see what the number is. It's like 3,200 and some days or something like that. But really all matters is the 24 hours of today. And when I'm speaking with the guys and the gals here at the center or anywhere I go, a lot of times I have to tell them, like, sometimes you just got to break it down into 60-second intervals. And it's about breathing. Just breathe. 60 seconds goes by. All of a sudden, another 60 seconds before you know it, an hour's passed. Right. And then the 24 hours has passed, and you lay your head down and sleep, and you go, okay, if I do that again tomorrow, I can get through it. Yeah. So I'm not a big counting days guy. And these are all partial to whoever the individual is. I do love the idea of 90 and 90, which is a first 90 days of sobriety. You go to 90 meetings. And
at least.
Right. At least. Double it up, go to 180, do 2 meetings a day for 90 days. It doesn't matter what it takes to get done. So I'm not a big believer in counting days. I know that I'm going to have 14 years if I'm able to make it April 1st. Yeah. I like that. I just kind of like the anniversary of it all. Sure.
But anniversaries function the same way, right? Like there are opportunities to evaluate, okay, like what have we done here? What worked over the last year? And
I thought 2025 was a hard year for me. I thought I was not as grateful in 2025. I thought I was angrier. I thought that there were things that got my goat much easier that I reacted to differently. Okay. And so, like a New Year's resolution, I made it a point in 2026 to, because I think the superpower that I have is my perspective. Because of where I've been and what I've gone through. The fact that I love my bed at night. And other people might not have that same perspective because I slept on a steel slab for 3 years. So I have to remember that. And I should be with the life that I have and the kids that I have, but I felt like there was something that was kind of deviating me away from that grateful perspective. And so, to your point, anniversaries tend to have you reflect a little bit on like, where can I, because I just don't want to settle and think that everything's okay either. I want to advance in my relationship with my wife, with my kids, with my friends,
Sure.
with my businesses.
Yeah.
It's just how I want to do it. And I felt like I lacked in that in 2025.
I think that that's something we can all, I mean, self-included, we can all take a page out of your book and reflect upon ways that we can practice gratitude more regularly, more consistently, daily, talk about every 60 seconds or so, and then move more into that space of like, I mean, this word gets thrown out all the time and it almost makes me want to cringe, but intentionality.
Intentionality.
You know how people are so intentional these days. But maybe we can all be more intentional, but more intentional in the best way, and then practice gratitude.
Instead of just kind of being so scattered.
Yeah, and really being thoughtful in our approach to like how we are with work and with relationships with family and with life overall. All right. I think we're going to be back with part 2.
Or 3.
This
is good. Fans, keep sending in your questions. These are good because that was just 3 questions and we did 20 minutes with y'all.
All right, we'll be back.